Hi, my name is Julie Shottland Cox, and I am an American physical therapist living and working in Greece, working with the refugee and migrant community there. Um, when I first arrived in Greece, I tried to volunteer my services as a physical therapist, but as I looked around, it turned out that was virtually impossible because there was no physical therapy being offered to this population. So I spent the better half of 1 year working in a community center, doing case management, and then making home health visits to families with disabled members, and also raising money for urgent medical needs for refugees and wheelchairs, nutritional milk and medications, that sort of thing. During that time, I was also advocating for the inclusion of physical therapy programs with more smaller grassroots organizations, the smaller NGOs. The larger NGOs were more primarily concerned with primary care and also mental health, and rightfully so. So I was successful and helped implement 3 new programs. We have one in Athens and then one each on the island's reception centers in Samos and one in Lesbos. The clinic coordinators now consider physical therapy an integral part of their programs, and they refer approximately 30 to 50% of all their patients for physical therapy. And I think as physical therapists, we're in a really unique position because not only can we treat the patients effectively without the use of medications, which previously was all that they could do, but we can also be a point of contact for people with neuromusculoskeletal pain disorders, thereby allowing us to unburden overworked doctors and nurses. So the programs have been really successful in triaging greater numbers of people, increasing the census of the clinic in any given day, and obviously providing effective relief for patients with no other treatment options. And this is Lilian, who wants to tell us a little bit about her background. She, I think, works in Qatar and Lebanon and Syria.
Yeah.
Yes?
No, actually, I'm working now in Qatar, but I'm Lebanese. I worked in Lebanon for many years, and I had some experience with the Syrian refugee camps in Lebanon. We have been conducting sessions more for stress management, kind of laughter therapy to make them cope with their poor conditions, having the biggest number of refugees in Lebanon and all the conditions in which they are living. So we have been discussing in this panel about the language barrier, the difference of culture and all that. I think, it could be a problem if we are not really prepared for that. But I'm sure people working with migrants and refugees, they have enough experience in that. And it would be also even better and more enriching to have like training programs for physiotherapists interested in this field, with more courses, training, to be working with the refugees in the camps to see in which conditions they live, so they can relate physical and mental health, and and focus more on the psychosocial aspect, because we can interfere as physical therapists. We can interfere very much and give a push forward for those people to cope with their current situation, and to help them be reintegrated in the society in which and the community in which they live, for the time being until going back to their countries.
I think that a point to take away for students of physical therapy or entry-level physical therapists is if they want to prepare for this, they should perhaps do a little research. They should come into it with the understanding that when you're working with this population, we know that 50 to 70% of the patients have been victims of torture or rape, and in the case of Greece, there are studies that show that practically 100% of the patients patients have some sort of reduced mental health state, so that when you go into your practice, you should be more aware that you're going to be facing that, and you must ask for consent to touch. You must be aware about where you put your hands, and any other cultural respectful things that you need to take into account. But by doing case studies and understanding the things that you might be subjected to, I think that you can quickly realize whether this is a line of work that you want to pursue, because it's not for everybody. You can leave these experiences feeling really emotionally drained. Their stories become your stories, and if you fail to reach them in any way, that sits with you, because of course as a physical therapist we just want to do good, and we don't want to contribute to anybody else's harm, or we don't want to make them any worse and make their situation any worse than they really already are. So the difference between having a purely physical therapy practice and, like Lilian is taking some further mental health masters, I think, and the two would be a meeting in the middle of trying to have some sort of a psychologically informed practice.